Acceptance, trust and boundaries are established during which phase of the therapeutic nurse-client relationship? A. Orientation. B. Working. C. Pre-interaction. D. Termination. The answer is A. Orientation. Acceptance, trust, and boundaries are established in the orientation phase of therapy. Identify the disorder that presents the following signs and symptoms: numbness, paralysis, loss of vision, or other neurological symptoms after a traumatic or stressful event, without any identifiable medical cause. A. Conversion disorder. B. Bipolar disorder. C. Schizophrenia. D. Stiff person syndrome. The answer is A. Conversion disorder. Conversion disorder is typified by numbness, paralysis, loss of vision, or other neurological symptoms after a traumatic or stressful event, without any identifiable medical cause. Schizophrenia, bipolar disorder, and stiff person syndrome all have medically identifiable causes. What is the best approach towards dealing with a delirious patient? A. Frequent sedation with antipsychotics. B. Frequent sedation with benzodiazepines. C. Frequent reorientation to time, place, and name. D. Frequent 4-point restraints. The answer is A. Frequent reorientation to time, place, and name. Delirium is an organic dysfunction of the brain usually seen in sick patients post-op. These patients need frequent reorientation to name, time, and place until the delirium resolves. Agitation, confusion, and difficult to control behavior is typically controlled with antipsychotics, however, they are not first-line treatment. Restraints should be avoided at all costs. Which of the following describes the professional role of the nurse in a healthcare setting? A. Caregiver. B. Patient advocate. C. Assessment. D. All of these. The answer is D. All of these. All of these are important professional roles of the nurse in a healthcare setting. You are a new nurse taking care of a patient with congestive heart failure. You see an order to administer 500 milliliters of 0.9% normal saline over 6 hours. Later on in your shift, you realize that you mistakenly administered 2000 milliliters of 0.9% normal saline over 2 hours, and now the patient is slightly short of breath. Which of the following is the most appropriate next step? A. Do not tell anyone of the error since the patient is stable. B. Immediately inform the covering physician. C. Immediately contact your hospital's safety oversight committee. D. Immediately administer furosemide to diurese the patient. E. Ask your co-nurses whether or not to inform the covering physician. The answer is B. Immediately inform the covering physician. In this case, a medical error was committed, and the most appropriate immediate course of action is to let the patient's covering physician know, so that they can determine what effect this may have on the patient, assess the patient, and determine what, if any, immediate intervention needs to be performed to ensure that the adverse effect on the patient is minimized. While it is possible in this case, given that the patient has congestive heart failure, and that they may have been fluid overloaded by the administration of excess fluids, that they will need to be diuresed with furosemide, This medication cannot be administered without the order of the covering physician, and it would be inappropriate to administer furosemide without their orders. While your hospital's Safety Oversight Committee may ultimately need to be informed of this incident, the most immediate priority is patient safety, and as such, the patient's physician should be notified of the medical error before anyone else so that they can best manage any immediate consequences of the error. It would be highly inappropriate to not inform anyone of the error, as an unintended dose of 4 fluids was administered, and this can be dangerous in a patient with congestive heart failure. Any delay, whether due to not telling anyone, or to conferring with co-nurses, in informing the supervising physician would be inappropriate and potentially dangerous to the patient.